First off, again, my name is Jeff Clark. I'm a regional director here with GoldenCare USA. A little about myself. Typically what we do is we help agents, sift through the different products we have, help them with marketing and promoting, etc., and do a lot of product breakdown. We do a lot of things, a lot of tools out there to kind of help you compare the different products we do, whether it be long-term care or critical illness, or you're always looking for these tools that can really kind of just quickly break down the market for you and give you a snapshot of what you're looking at. CSG Actuarial Calculator is more or less the best MedSup tool that I have found or used in my 20 years of doing MedSup work. Not as many of our agents take advantage of it. That's part of the reason we wanted to have this topic today. Is it's a tool that's available for you on GoldenCareAgent.com. As long as you're a licensed agent or rep with us, you have access to this thing. So we want to do a webinar just to kind of give you, I guess, to go through how it works, and I'm hoping again we can learn a lot about what we can, how it can work. I really like the tool myself. I've used it for, again, I don't know, 4 or 5 years now. And essentially, not to steal a thunder here, but you can look up a zip code and find out any Part D that's in that zip code, any Medicare Advantage plan, the cost, the details about the plans, the premium, the MedSups, whether it's Plan G, you want to see every Plan G and whatever zip code. I can't say enough about it. I love using it. And so without too much more here, I'm going to turn it over to our presenter this morning. Brian, go ahead and introduce yourself.
Yep, sure thing. My name is Brien Welch. I work for a company here out of Omaha, Nebraska called CSG Actuarial, and we build and provide these quoting tools. And so today we're going to kind of go over the tool itself. If you use the tool in the past, this might be a good video to understand maybe there's certain things with the tool that you didn't know existed. And if you haven't used the tool in the past, this will be a good introduction to what you can do through the tools. And so we'll go ahead and get started here. The screen that you're looking at in front of you is the initial screen of the page that you get when you logged in. This is just the dashboard or the home page, so to speak. To begin running quotes, all you need to do for one of the product lines is just click Run Quote. And so both MedSup and Medicare Advantage will have a demographics page. This is where you'll type in the demographics of the person you're trying to run the quote for. So we'll go ahead and type in the zip code here, and this will run any zip code in the country. And so wherever you're at in the country, if it's a valid zip code, it'll run it. And so there's no limitations on where this can be done. Everything from Hawaii to Maine can be run on the system, and it'll give you the corresponding county and the city and state that zip code corresponds to. You can then select your age, your gender, and your tobacco status. For MedSup, obviously that's important. This would be based upon the person that you want to run the quote for, as well as the plan. We default to F, it being the most popular, but as you can see, if you click the drop-down, you can select any plan A through N. And then lastly, we have an effective date here. Say you wanted to run a future effective date. You wanted to see an 8/1 or a 9/1 quote or a 10/1 quote or whatever it may be, because the app is not going to be issued until a future date. You can run a future date to make sure you're looking at the most correct rates in the event that a rate is changing after that application has been submitted. And then lastly, we have a client or quote label here. This really just is if you wanted to personalize the quote, we allow you to print or generate a PDF to attach to an email. That's really where this comes into play. So if you wanted to run a quote for, say, Mr. John Smith, you can personalize this quote to the person if you were going to give them the actual rates and you wanted to have a header at the top. We'll go ahead and press Get Quote here. It's going to price out this 65-year-old female non-tobacco Plan F. We price these cheapest to most expensive. So you'll notice that's how they're ranked. We're non-biased. We are not in the insurance sales side of the business. We show every carrier. We don't highlight one carrier over the other. And so that's simply how we're ranking them as cheapest to most expensive. These update automatically, so as the rates change throughout the year for all the companies, the system will update in real time. What you're looking at here is the results page. We'll start here with the company box. Obviously, we're going to give you the price per month and the company name, but we're also going to give you a household discount and policy fee, just if it's available. If the policy fee or household discount is not something that the plan offers for the state or combination that you ran, this will be blank. So, for example, Unified Life does not have a policy fee in the state, so it's not there. You can apply this discount to the rate either on that initial quote page or by just clicking that Apply Discounts button. And the pricing will adjust and the order of the companies may change. So 2 may jump to 1 or 5 may jump to 4, depending on the size of the discount and what gets applied to that base rate. We have some initial company information as well, everything from if there's a parent company to if there's an AM Best and S&P rating, if there's a rating class, for example, like United Healthcare has a level 1 and level 2, that'll be in the rating class field, as well as the years in the market and the effective date of the rate. This is not the effective date of the app or of the policy being issued. This is when that rate went into effect, and that would still be active today. Last thing we have here is the plan details in terms of the company quote box. If you click plan details, this is simply just a breakdown of the benefits. Obviously, no matter what company you click on, the benefits will be the same for MedSup. If you switch from F to G or G to N, this obviously will change, but it's just giving you services, what Medicare pays, what the plan pays, it being Plan F, and that we or the consumer would pay, and this being Plan F, it's all zeros. And so that's the basic company level information here. And so kind of a different toolbar options. The first is going to be your quick quote section up here. Both MedSup and Medicare Advantage will have this. This is if you wanted to switch from, say, F to G or G to N, or you want to switch from female to male, or you want to change the effective date of the zip. Rather than having to click back and forth, you can just do it straight there on the screen, just kind of an ease of use type of deal. You can also switch your sort by. So if you'd rather have it just alphabetically, or you'd rather have it rated or ordered by ranking, we do have agents that only want to write A-plus rated companies or what have you. You can sort by different areas, but it's going to default to price. Obviously, that's the most important piece of the quoting tool. And then on the left-hand side here is our toolbar side. The first kind of top is going to be your compare quotes, and say you wanted to take maybe 3 of these plans, take them away from the main list, and just have those 3 plans side by side. All you need to do is click the company names, and they turn green, and then you can just click compare quotes, and it'll bring you to a new page where it's just these 3 plans side by side here. And you can print this off, you can export it to PDF. It's just a good way if you were going to obviously provide this information to a senior and you didn't want to show the full list, you just wanted to show a handful or 1 or 2, that's a good way to do a comparison of a handful of plans. We also have our export features here, the first being the blue print button, obviously pretty self-explanatory. It puts it in a printer-friendly format, strips out the color. You can print this off to take it with the meeting or to hand it to a client. We have our red PDF button, also pretty self-explanatory. If you wanted to generate a PDF of this and attach that PDF to an email or save this quote to your computer in PDF format, you can generate a PDF using that button there. And then we have our green Excel button. We do have users that like the raw data aspect of it. They'd rather deal with just the numbers in an Excel database. And so we allow for that option. If you are an Excel type person, you can just dump this into an Excel database and go on from there. Below that, we have adjust your view settings. The first is going to be expanded or contracted views. This is just a simpler view. If you'd rather not confuse your client or you want a simpler view, just the price and the company name, you can click that expanded or contracted view, and it just is a more simpler type of style. And if you print it off, it'll look just like, it'll mimic what is on this screen. So if you'd rather print or generate a PDF in this simpler format, you can. We already went over the apply discounts. That's just to apply that household discount to the rate. Third one down is annual rate. Obviously, if you'd rather see the annual rate versus a monthly, you can do so there, and it'll adjust the pricing accordingly. And then the next one down is the market analytics, and this is going to be 3 different things, and Liberty Bankers and Unified are brand new plans, and so they're bad examples, but here Manhattan's is a good one, and so this would be a good example for the call. What we're showing you here is 3 different things. First is age increase data, and so for attained age policies, obviously if it's issue age or community rated, this will be blank. It just won't show anything. But for attained age policies, it'll show you each year the insured gets older, what they'll pay in the following year. So, hey, you can say, you're going to pay $119.08 today, but as you turn 68, it's going to go up 4.5%. Really gives you an idea to your clients, or for yourself, for your own research, understanding how these different companies handle attained age policies, if you are, in fact, in an attained age state or dealing with an attained age rates. So that's age increase data. The next here is increase history, and this is since 2010, so you won't see anything previous to 2010, and the reason that is because they modernized the plans in 2010, and so that's when we've been tracking this information. And so it'll show you each year that the company has changed or filed new rates, what was the data change, and what the percent of change was, either up or down. Some companies will have a bunch. Some will maybe have only 1 or 2. Some are newer, like the top 2 we have here. These are newer in this state, not even a year old, and so they have not filed new rates yet. So some will say NA. And so it's going to be variance based upon the state and the combination that you're running. This is state and plan specific, so if we were to switch to G, this may be different. Same with this age increase data. And so it just really gives you a good indication of how that company has handled rate changes in the past. And the last thing here is market data. This is NAIC data, or the National Association of Insurance Commissioners, and the companies self-report this information once a year to the commission, and the commission provides us this data to place on the tool. And so this gets updated every April, and so what you're looking at is 2016 data. Obviously, 2017 isn't over, and so we're going to report that till the end of the year. But this is going over lives insured, premiums earned, loss ratios, and market share percentage on both a state and national level. Not necessarily information that everybody's always interested in, and not always information that a consumer is always interested in, but we really view the tool as a market advisor tool, not just a quoting tool. We want to be able to provide the full picture of what the rate of that company provides, and so that gives a really good indication or information on how ingrained that company is in the market, both nationally and for the state that you're looking at. Another thing to mention here that's important is the loss ratios. And so if you're unfamiliar with how what loss ratios are, that's a percentage that determines what they paid out in claims. So for example, nationally, Manhattan Life paid out 71 cents for every dollar they collected in premiums. So it's 71%, so they paid 71 cents for every dollar they collected. The higher the loss ratio, the more likely you are to see a rate increase. That just gives you a really good indication. If they had a previous loss ratio of 90%, it's a really good chance that the rate increase is coming and that it's going to be a substantial increase. If their loss ratio is closer to, say, 65%, they have a really good loss ratio. Statistics or history would show that the rate increase, if any, would be very small, or maybe possibly even a rate decrease. And so that's just gives some good base company level information there. And the last thing here we have is select plans. If you are in an area or dealing with a state or companies that offer select, you can click the select option, and below the rate it'll have a black select label, just letting you know that you are looking at a Medicare select option. And the last thing here is the health questions. And so if you are dealing with somebody outside their open enrollment period and they do have to go through underwriting, you can click this drop down and you can either search or scroll through different conditions to find out, based upon your client's medical history, what companies would actually issue that person a policy. So the tool really helps you not only understand price, but who actually would even issue coverage. And so let's say you're dealing with somebody, they have to go through underwriting, they're switching plans, and they have a heart attack in their medical history. You can then click heart attack or enlarged heart or whatever it may be, and we're giving you two different things. We're giving the criteria, which is obviously heart attack, and the look-back period, which is 2 years. So for bankers, for lower-level bankers, the look-back period is 2 years. Therefore, if they've had a heart attack within the last 2 years, they'd have to answer yes on the app, and therefore it's going to be used as an item of declination for them getting issued that policy. If they had the heart attack 5 years ago, they could answer no on the app and continue with the application process. And so every company will be different. Unified's 2, but Manhattan is 5, and so on and so forth. Really helps you narrow down those results in those types of non-guaranteed issue situations. And so that's the underwriting. That's a really good overview of the MedSup tool. I'll say this again before the call, I promise, in terms of we really think that if you could, after you run 1 or 2 quotes, you really become a pro at this. We try to make the tools as easy to use as possible and easy to understand as possible. You can always click this down here below about this quote. This really brings up some information on what we're looking at. And so if you ever start looking at something and you want to know, well, hey, I'm confused about this, or I'm unsure about what I'm looking at, you can click that About quote, or you can always click this Contact Support. And if you're ever having issues with the tool, you have questions with the tool, you're stuck, you can click that Contact Support and send in an email, and it gets responded with in 24 hours. And so just want to preface that if you get stuck, you're not hopeless. It's not hopeless. You can always get get more information or get help. We'll go ahead and switch now to Medicare Advantage. And Part D. And so to switch or to navigate out of this, you can just hover over this label here, and you can go back to that dashboard page, which is the home page, or you can switch over and go to Medicare Advantage. And so we'll switch over to there. Same demographics page as before. We'll go ahead and type it again, any zip code in the country, and they'll give you the corresponding county and city and state. You can select your plan, which we're going to run MA. But if you wanted to run the standalone Part D, or you wanted to run the special needs plans or the SNPs, you can. But it's going to default to the Medicare Advantage. Last thing here is the effective year. This really only comes into play in the fall when the new 2018 plans come out. If you wanted to still run a 17 plan, you're early in AEP, you can switch between 17 and 18. That's really the only time that comes into effect, but we'll go ahead and run a 2017 year quote. Again, it's going to price these out cheapest to most expensive. As you probably know, they're usually a $0 per month cost. So it's ranking these by max out of pocket. So lowest max out of pocket at the top and moving down. Same as before, we're giving you some basic company level information, your star rankings, drug deductibles, if there's gap coverage, AM Best and S&P ratings if they apply, as well as a drug deductible and what type of plan type it is. If it's an HMO or a PPO, just some base company level information. Your quick quote section is still here. Your compare quotes and your export features that we went over are still here, as well as your expand or contracted view. We also have market analytics with Medicare Advantage. And so what this is going over, it's going to be a little bit different than the MedSup. The first box here is going to be based upon the county, not the plan, and this next one here is going to be based upon the plan itself. But what you're looking at, and this updates each month, and so next week we'll have an update for July. But for each month for this year, we're showing you on a county level how many total county eligibles there are, how many total Medicare enrolled in that county there are, and what the penetration percentage is. So total Medicare eligibles, total Medicare enrolled, total Medicare penetration for this county. And then we're showing you this same county information but on the company level. So we're showing you by month how many are enrolled with that county. So out of the 2,352 in June, this Coventry healthcare plan is 2,806, and the penetration percentage for that. So it really gives you a good indication on what the county looks like in terms of Medicare and what that company looks like within that county as a whole. And so that's the market analytics for Medicare Advantage. Again, this updates once a month. And so, like I said, next week you'll come out and we'll have July out there. But that's kind of the base company level information for the Medicare Advantage. If you do want to see the additional benefit information, your co-payments, co-insurances, in and out of network costs, you can just click this Plan Details button. It then takes you to that benefit information. And so you can see your doctor's office visits, you can see your emergency care, home health, inpatient care. Here's all that in-depth benefit information. As you know, these will vary based upon company, and so it's important to take a look at this to know how they differ. This is also how the compare screen works, so if you wanted to compare other benefits side by side between the companies, you can do so on this page rather than by price. That's really the tools in a nutshell. Jeff, I don't know if you wanted to open it up for questions.
I was going to open up Brian, I'd love to open up the questions. I just wanted to put a couple 2 cents in if I could. Great job, Brian, going through some of those stuff. Again, I've used this tool for years, and you just kind of opened my eyes to a couple more things. Just great tools in there. Do me a favor, just go back to Medicare Supplement real quick. I just want you to run a different zip code and a different plan.
Yeah, absolutely. What zip code?
Let's look at 44811. And then let's take a look at Plan G.
Plan G, okay. Let's go ahead and run a 65-year-old non-tobacco female Plan G in this Ohio.
The reason I just do that is just to kind of show the folks that every zip code is going to have different competitive things. And it's so nice for me when I talk to a client, because I just had this one call from Ohio just yesterday, and so I can go on here and I can show her, here's. Like, for example, here's United World, Mutual of Omaha, number 2 in national sales, A+ rated. You've got 97. You've got a household discount available. In other words, they're going to be the number one, in that market price-wise.
Yeah.
Great
if you
quality
apply
product.
This discount, they'll be number 1.
Yeah, and so, in other words, I guess it's just, for me, when I'm selling to folks, it's nice just to show them, we're not guessing here. I like to throw all my chips, all my cards on the table, and let them see everything. And so sometimes if you're sharing screen even, or I can PDF these and send them out to them and say, let me take a look at all the Plan Gs and Plan. Maybe these customers are thinking about buying Plan F, maybe Plan G. I go ahead and just pull and do a PDF of the companies that are available. They can look at the ratings on them, and then again, some of the things that you showed. If you need rate increase, history. We've all been there trying to sell to folks. When you ask them questions, it's kind of hard to dig out all the rate increases for a certain carrier, over the years. Ratings, rate increase history, loss ratio, the stuff that you just showed there, Brian, is just invaluable to have that information on the fly immediately to show your clients. It really puts you in just really the expert mode, if you will. People just tend to gravitate towards that kind of expertise. And I think it's just the things that you showed here. And again, just showing the folks, here's what your market looks like. Like you mentioned, we're not necessarily biased towards any company. Myself, I've got A-rated companies, 5 to 10 companies, and most of them are going to show up in that top 5 or top 10. And a lot of times you're talking about a difference of a couple dollars a month. And so whether or not you like to work with B+ companies or B or just only A-rated companies, you can typically find a top-rated, top national sales, A+ rated company somewhere in that top 5 by looking around and using those. And GoldenCare has most of those plans available for you. And so, again, Brian, great job on this. I will turn it over to questions. I really do believe in it. I use it daily just to give people an idea of what the market looks like. It really helps you, I guess, that expertise I mentioned earlier. So let me go ahead and just turn this over to questions. We do have a lot of you on there. And feel free to chime in. And I guess, Brian, I'll let you kind of address them. And if there's something I can help out with, we'll go from there.
Brian?
Yep.
I got
Yep, go ahead, guys.
Hello?
Yep, go ahead.
Under filter quotes, you have containing HH discounts, which I assume is home health.
That's household discount. So that's the household discount. So if they apply, whether they have a spouse signing up for them or they have somebody living in the house that's maybe 18 years or older, they can apply for that household discount. That's what that's referring to.
I see. Okay, thank you.
Yep. Hey, maybe I'll let you answer the question. If we keep that background noise, I'll put on mute for the answer. How about that? Well, anyone else there, anything at all for Brian or myself or about the tool?
And if you can't think of stuff today, you can always email Jeff or email in. You can email me directly as well, and we'll make sure we get those answered in the future. If you don't think of something now, but you think of something, tomorrow or next week.
Okay, and I'm going to give you GoldenCare's number too. GoldenCare, depending on what state you're on, just call in and we'll get you the director. We can talk about the products we have available in any given market. Again, we should have a nice supply or a nice variety of carriers for you, but GoldenCare's number is 800-842-7799. And again, feel free to call us in if you want to add a few carriers. If you see that one carrier is continually showing up in certain markets that you're working and you don't have that carrier, we're happy to set you up with that contract and get you going with them. Again, kind of like Brian alluded to, we're not necessarily married to any carrier. We're just trying to do our very best for our customers. And so if there's a carrier that continually is showing up in multiple markets, likely GoldenCare is going to add that carrier so you have that arrow for your quiver. I want to thank Brian for coming on. I'm going to put it back off of silent mode here again in case there's any more questions. But again, thanks a lot for coming on this morning. Take advantage of this tool. Again, it's really, like I mentioned in my opening, we do compare and contrast a lot of these products out there for the product lines we have. And as far as Medicare supplements, I haven't seen a better tool or a better way to get information that quickly and have it organized in such a concise manner. So we really, really love this tool. I just want to thank you for coming on again, Jeff Clark here, and Brian, thanks for your help. I'll open up for questions one more time, and if there's anything else, just let us know. Well, Brian, thanks a lot for coming on today. I appreciate it. Give us a call, GoldenCare, give Brian a call at CSG there. Thanks for attending our webinar this morning. Again, if you have any questions, give us a call here at the marketing office, 800-842-7799. If there's no other questions, then I'll go ahead and wrap this webinar up. Thanks a lot for attending, everyone.